Welcome back to the Urology Care Podcast. Our guest today is Dr. J. Stuart Wolf. He's Associate Chair for Clinical Operations and Chief of Division of Surgical Subspecialties at the University of Texas Dell Medical School in Austin. And today we're going to be discussing what kidney cancer patients should know during COVID-19.
First of all, thanks very much for having me on your podcast, Casey.
It's great to have you yet again join us. So let's jump into it. Has COVID-19 been known to cause kidney damage?
So kidney damage related to COVID-19 illness has been reported, but at this point it does not appear to be a specific kidney effect of the COVID virus, but rather it's just when you get really ill, many organs can have problems, including the kidneys. So it's not a specific aspect of the virus.
And is it safe for a patient to delay kidney cancer surgery during the COVID-19 pandemic?
So that is a really great question. As any listeners who have been scheduled for surgery over the past few months might know, it can get a little confusing about what is supposed to go on. First of all, there are in fact several good reasons to delay a surgery during this COVID pandemic if it can be done safely. Just like we're trying to limit really any non-essential activities during COVID. You don't go out and go to a restaurant and, go out and go swimming someplace or partying in the park. And for the same reason, you might not want to do some, quote, non-essential healthcare. Social distancing and avoiding unnecessary movement are cornerstones of COVID prevention. And going to a hospital where there might be a lot of sick people, and certainly a lot of people overall, that kind of violates the principle of social distancing. There are other reasons why the hospital itself might want to limit surgery. A hospital needs to preserve the PPE. They need to preserve their capacity and their staff. If all those things are being used for an elective surgery, it can't be used for managing COVID patients. And finally, there's some risks if the patient has COVID. If you happen to have an asymptomatic COVID infection and you have surgery, the risk of complications is very high. And conversely, if you have COVID and undergo surgery, you're putting the staff and the surgeons around you at increased risk. So that's why we are trying to delay some surgeries during the COVID pandemic. But the obvious question, of course, is now, okay, well, what is essential care? What can be safely delayed? And that gets to exactly the question you're asking. And there, the risk of delaying surgery for kidney cancer is related primarily to the size and the stage of the presumed cancer. So for small cancers, those that are less than 4 centimeters, it's generally thought pretty safe to delay, even for up to a year. I mean, we manage a lot of patients with masses less than 4 centimeters with what we call active surveillance, where we're just watching them and making sure they don't grow. So certainly waiting for, a few months up to a year would be perfectly fine. Now, for larger cancers, those that are, we call stage 1 between 4 and 7 centimeters, and even stage 2 more than 7 centimeters. There is less experience with waiting, but the data would suggest that waiting up to 6 months appears to be safe. So if you have a larger kidney mass and you and your doctor have talked about surgery, waiting a few months is probably okay. Now, if your cancer has started to grow into surrounding structures, such as the veins that come out of the kidney, then delay is not recommended, because the thought is that at that point the cancer might be getting very aggressive and you want to get things out as soon as you can. And then finally, we have the situation where sometimes even for metastatic kidney cancer, we will often recommend surgery. It's been shown that in certain situations, if you remove the primary kidney cancer, even if it's spread to other parts of the body, there's a great benefit to the patient. The current recommendations are that during the COVID pandemic, that is not a good idea. So if you are scheduled for a nephrectomy or you were thinking about a nephrectomy, as part of management of metastatic disease, it's probably not a good idea to do that, and that's something you'd want to bring up with your doctor. So I think I've kind of covered the spectrum there from the very low-risk small cancer to the highest-risk metastatic cancer, and it's kind of a graded response.
Are kidney cancer patients at a higher risk of getting COVID-19, as far as we know?
So it's interesting that the patients who seem to be at increased risks, not necessarily of getting COVID-19, but of having complications from COVID-19, you know, people who, if they get it, are more likely to get ill. Interestingly enough, those are the same patients that are typically get kidney cancer. Older men, often with hypertension or other comorbidities, and those are often the patients that are higher risk of COVID. But in general, it's thought that the kidney cancer itself does not increase the risk of COVID. There's no evidence of that any particular cancer will increase the risk of either getting COVID or getting complications of COVID. But of course, if you have a cancer, that itself might be making you debilitated in a week, and that, of course, could place you at increased risk of having complications of COVID. More likely, it's actually not the cancer, it's actually the treatment of the cancer that might make you more debilitated and more at risk for complications. And that actually gets back to the first question. That's, of course, one of the reasons why we're not recommending surgery in some cancer patients, because simply the act of having surgery makes you temporarily ill for a little while as you're recovering, and that might make your response to COVID more dangerous.
And just to ask kind of the flip side of that last question, does getting COVID-19 place a patient at a higher risk for kidney cancer?
There's no data on that, but there's really no reason to think so based upon what we know about the virus.
Is it safe for a patient to stop or pause ablation and other local therapy to treat kidney cancer during the COVID-19 pandemic?
So the answer to this question is kind of related to the question about delaying surgery in general. One of the advantages of the ablation or other non-extirpative therapies, local therapies for kidney cancer, one of the advantages is that it's not as hard on your body. It doesn't debilitate you as much. You're not in the hospital for as long. You're not laid up for quite as long. The risk of complications is lower. And that actually is an advantage, particularly in the COVID era, because, if you are going to get a small renal mass treated, and we talked about that it's probably safe to delay treatment for a small renal mass, but if you are going to get it treated, well, having an ablation probably puts you at less risk than having a surgical partial or radical nephrectomy. So, yes, it is safe to pause ablation or other local therapy, but there actually might be preferred treatments during the COVID pandemic if you are going to need to get your kidney cancer treated.
Thanks, Dr. Wolf. And of course, we care about your safety as well. So any thoughts on how you're taking precautions to protect yourself as a healthcare provider during this uncertain time?
Oh, well, thank you for asking. No, it's, the healthcare providers are a vital link in keeping us safe during this pandemic and preserving the capacity in the hospital, which includes the ability of healthcare providers to continue doing their job, is very important. So our hospital, as have many hospitals around the country and the world, have instituted very careful programs to screen both the staff and the patients when they come in the hospital. We're getting some surveillance testing now and then. We have very strict rules about what we need to wear in terms of PPE, when, who we're supposed to interact with, all dedicated towards keeping ourselves safe. I'm pretty confident it's working well in our hospital because the majority of our staff who have come down with COVID have not had it from a hospital contact. They've probably gotten it from something they've been doing outside. So one thing I would like to say to all the listeners is please do, wear your mask, do the social distancing, don't do non-essential travel, things like that. These are all very, very important measures to try to reduce the spread of this disease.
Our guest today has been Dr. J. Stuart Wolf. He is Associate Chair for Clinical Operations and Chief of Division of Surgical Subspecialties at the University of Texas's Dell Medical School in Austin. Thank you, Dr. Wolf, for joining us today.
Thank you very much.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.